Okay. What kind of patients do you see here in the hospital?
The cardiac patients, the main complaints of them will be like chest pain or shortness of breath during exertion, with even accustomed work. Previously, they used to walk, say, some 1 kilometer. Now they couldn't do that because they are getting easy fatigability and shortness of breath during exertion. Those kind of patients, most probably the etiology will be cardiac, chest pain, shortness of breath, or easy fatigability, or palpitations, some kind of syncopal attacks in between. Those kind of patients, we should evaluate with them with ECG, basic thing, electrocardiography, or 2D echocardiogram, which is an ultrasonic machine. With the help of, we can see the chambers of the heart. Are there any septal defects? Are there any valvular stenosis or valvular regurgitation? Those kind of things. ECG will tell us whether there are any coronary ischemic heart disease. If it is so, it will give us a clue. Based on that, we will go for other level tests like treadmill test. Treadmill test is where we allow the patient to walk. Simultaneously, we record his ECG. If there are any coronary artery stenosis is there to the patient, then it will pick up and it will tell us what to do next level. The final level investigation is coronary angiogram, which is a daycare procedure where we will take the patient to the cath lab, which is being installed in our hospital. What they do is they put a catheter, small catheter, into the radial artery or femoral artery, and they will take the catheter up to the coronary arteries which are supplying the heart, and then they will introduce some dye into the coronary arteries, and they will see through that fluoroscopic image. It will clearly show us the level of obstruction and the severity of the stenosis, if at all it is there in the coronary arteries. So those kind of patients, layman will label as they will present with chest pain, that is a severe chest pain with associated with profuse sweating, and they couldn't take good breath also. So those kind of patients, if we evaluate with the angiogram and if we find coronary artery stenosis, then they are eligible for either balloon dilatation of the obstruction or put a stent through the cath procedure. Those procedures are daycare procedures nowadays. People can go to the home within one day or maximum 2 days they can go home. If the stenosis is so severe that they cannot balloon dilate the stenosis, or they cannot put the stent, or the stenosis is involving all the 3 coronary arteries that supply the heart, then those kind of patients are indicated for surgery, that is coronary artery bypass surgery. What we layman in Western countries they will call as cabbage procedure. Here we call it as CABG procedure. It can be done by 2 ways. One is taking the help of heart-lung machine, that is cardiopulmonary bypass machine help, that is called on-pump CABG surgery, which is done in most of the institutions like our CMC and AIMS, where I studied also. But in all private care setup where they want to cut down the cost, at the same time the same quality of the procedure can be done, it can be done without the help of heart-lung machine also. Heart is beating and we can do the surgery. Since it is a surface surgery, the coronary arteries are surface, it is located on the surface of the heart. We don't have to access the interior of the heart. So it can be done without the help of heart-lung machine. That is called beating heart CABG surgery, which is being done in all centers, which by God's grace I can also able to do, and we can cut down the cost also. So that is one surgery, one procedure that is related to coronary artery pathology. The other pathology which can affect the hearts are the heart valves. There are valves, 4 valves in the heart, whose function is to allow the blood to go to only in one direction. Get the bad blood from all parts of the body, reach the heart, it supplies to the lung, where the lungs, all blood is oxygenated, and then it will pump to the entire system of the body. If any valve is stenotic or it is leaking, that is called regurgitation in the medical term. If it is severe stenotic or severely regurgitant, then we have to replace the valve. That is called valve replacement procedure. Mitral valve, aortic valve, tricuspid valve, these valves can be replaced, or it can be repaired also. We don't need to replace, we can just repair it. That can also be done. So that is another kind of procedure. And coming to the congenital pathology, children's congenitally they born with defects in the septum, or we layman people here call as hole in the heart, or septal defects, that is atrial septal defect or ventricular septal defect. That is simple congenital pathology which can be easily repaired. We cannot do that with cath lab procedure, but it requires surgery. very few conditions can be dealt with device closure of the septal defects by help of cath lab, not requiring surgery. But most of the times they require surgery, where we close the defect with a patch, septal defect closure, or sometimes blue babies. You might have heard of blue babies, no? So where there is stenosis at the level of pulmonary valve, where the lungs will be getting blood from the heart. If there is stenosis, blood will not reach the lung, no oxygenation, so there will be entire deoxygenated blood circulating in the whole body, and that's why they are blue. So that blue baby operation is also done. We can do. Yeah, that is called the pathology. The medical terminology is tetralogy of Fallot, double outer right ventricle, tricuspid atresia, pulmonary atresia, single ventricle physiology. These are all the complex congenital pathology which we can deal with because I have been trained from AIIMS, where they do day in and day out the complex congenital pathology. So that can also be done here. That is one other level of pathology. The other level is great vessels pathology. The aorta, where the large blood vessel or the major blood vessel which receives blood from the heart, if it is dilated, that pathology is called aneurysm, or it can be dissected. I mean, the wall of the aorta, in between, if there is a what I call disruption or dissection in between, then it will be dissected. It's called aortic dissection. They are all present with emergency situations where we have to replace the entire aorta. So that is called Bental's procedure. Sometimes we have to replace the aorta along with the valve. So that is called Bental's procedure, or we have to replace the entire ascending aorta or descending thoracic aorta, those kind of things. Or abdominal aortic aneurysms that can also be replaced. So these are all the various subset pathologies which can be encountered in cardiac surgery practice. Cardiology part, where they do in the cath lab, they can do coronary angiogram followed by the treatment of the stenosis by balloon dilatation or by stenting the pathology there, coronary arteries, or congenital children, simple congenital pathology, they can do device closure of the septal defects. And they can do rhythm radiofrequency ablation of the rhythm irregularities in the heart, because all our heart beat will be in sinus rhythm, like lub dub lub dub lub dub. Regularly it will beat. For some patients, they will beat irregularly. Like variable things like atrial fibrillation or supraventricular tachyarrhythmias or ventricular tachycardias. So those kind of pathology can be treated by cardiologists in the cath lab by radiofrequency ablation, or by there are many other procedures which they are very familiar with.
Heart pacers and
Yeah.
things like that.
Yeah, they can put pacemakers also, permanent pacemaker implantation there, that
How
can
many doctors work here?
Yeah, right now there are 2 cardiologists already working here, seeing the patients in the OPD. One interventional cardiologist is coming. He will be joining here, and he will be doing the cath lab procedures, which will be the backbone of our cardiology department. And me, the cardiothoracic surgeon, who can operate cardiac patients. Right now we are four in number, including everyone.
And the staff?
Yeah, we recruited staff already. For OT, there are 3 staff, and for ICU, there are 3 staff. And in future, we will recruit more. We have been given them formal training also in one of the central hospital in Perambur, which is the forefront hospital initially. I mean, about 2 decades ago, the first heart operation was done in that hospital, which is situated in Chennai. So they are being sent there for training purpose. Yeah.
So your confidence is,
Yeah.
you're quite confident that
Yeah.
everything,
Yeah. Now everything is being ready.
Yes.
Patients are also ready. We have been waiting for a proper time to start the department.
I understand this building was open 2 weeks ago.
Yeah. By
And
God's
this
grace.
first patient will be when?
We're likely scheduling February 2nd or February 3rd week, because our cardiac anesthetists who have been trained in cardiac surgery setup, but for the last 5 years he is not exposed to cardiac surgery because the department is not here. Now sir is also going for observership for 2 weeks, Once he comes back, by Feb second week or third week, we will likely to start by Amma's grace or by God's grace.
It's very fortunate we were able to film you before you start.
Yeah,
Because
yeah.
once you start, we'll never see you.
No, not like that.
No, I must say, I'm very impressed by all the different areas that you can treat. It's amazing, and we wish you the most success.
Thank you. I need it actually.